Good evening, everybody. So we are back. We are doing our webinar series again that we had began back before we moved to Cebu. We stopped for a little while, concentrated on starting our clinic, but now we are back, and we are back with a bang because our first webinar is a very popular one. It is on optimizing the health and well-being of mom and baby throughout pregnancy and postpartum. It's a very complex and long topic, which we definitely are only going to scratch the surface with in the hour that we have allotted. But we'll do the best we can to give an overview, give you an idea of what you may or may not be doing, and some things that maybe you can fine tune. If anybody wants a more comprehensive pregnancy plan, reach out to me personally, either on Facebook, or you can reach out to me at my clinic at Form and Function Corrective Chiropractic in Cebu City, the Philippines. All right, so who am I? For those of you that don't know me, my name is Dr. Scott Jan. I am a licensed chiropractor. I went to school at the Southern California University of Health Science for chiropractic, graduated December in 2005. Before that, I went to Manhattan College and I graduated magna cum laude with a degree in sports medicine. I'm also a certified medical exercise specialist. I have professional applied kinesiology certification and pre-postnatal exercise certified. And then I also got a certificate of the strength conditioning specialist. All right. And been doing this for a long time, and pregnancy is definitely one of those things that we kind of proceed with caution, because not everything is right for everybody, and the consequences can be huge. So as we're going through this information, I want to use it as information only, right? You should always consult your primary care physician, doula, midwife, who you're using, because you want to make sure you have a safe and healthy pregnancy. And we certainly don't want to use this as medical advice. It should just be a guideline, and for you to kind of seek a conversation to start with your medical professional. Okay, so let's start with pregnancy at a glance. Okay, so there's certain things that happen when we get pregnant. By we, I mean the females that are watching. Okay. All right. So pregnancy at a glance, right? During pregnancy, the time period is somewhere between 37 and 42 weeks. Officially, they say 40 weeks, but 37 to 42 weeks is considered a normal pregnancy, which is 259 to 293 days. It's measured from the first day of your last menstrual period until the birth of the baby. Okay, we segment it into 3 trimesters, right? The first trimester is from conception till about 12 weeks. Second trimester, 13 to 27. Then the third trimester is from 20 weeks until birth. Okay, so in these 3 trimesters, it's really, sorry about that. Third trimester, that is when the baby really explodes in birth, and we'll be discussing that in a moment. Okay. Next. So there's a couple of terms that you might want to be familiar with. One is perinatal, and this is a term, it has different definitions. I'm going to use a definition that the International Classification of Disease, ICD, defines as perinatal, which is typically a time period that starts at 22 weeks of gestation and lasting through several days of birth. They define perinatal as the time that you can have a stillbirth, right? Up until that time, if something happens and you have a spontaneous abortion, it's not considered a stillbirth until 22 weeks of gestation, right? Then there is prenatal, or sometimes referred to as antenatal, which is before the birth process, and postnatal or postpartum, meaning after birth. Another term is something called quickening, and that's the perception that mother has when the baby starts moving in the womb. And that happens at about 16 to 20 weeks of pregnancy. So some things that happen, right? Primarily, let's start with weight gain. Right? Ideally, proper weight gain during pregnancy is somewhere between 25 to 35 pounds. That's 11.5 to 16 kilos. Most of that gain will be in the later trimesters. The first trimester should only gain about 2 to 4 pounds, and then 1 pound every week after that. And the baby will account for about 7.5 of those pounds. And then we have various other reasons for gaining weight, such as the amniotic fluid being 2 pounds. We'll gain 4 pounds of blood, right? The body will increase blood 40 to 60% during the time of pregnancy, which is huge, right? When it equates to about 4 pounds. Other body fluids will be 3 pounds. Breasts should increase in size about 2 pounds. Fats, proteins, and other nutrients will be 6 to 8 pounds. The placenta is going to be 1.5 pounds, and then the uterus will increase in weight by about 2 pounds. Okay, some other body changes that you have to look forward to during your pregnancy is circulating levels of relaxin will increase during the first trimester. Relaxin is a hormone that gets the mother's body ready for that expansion of the uterus. So ligaments can easily stretch without tearing, but it also makes for hypermobility. So when we discuss exercise, right, we want to create some restrictions or some guidelines that maybe agility training or something like that should be put on hold because of that laxity in our ligaments. Frequent experience with overwhelming fatigue, because as we said earlier, the body's going through extreme changes, increasing blood volume in such a rapid time frame, 40-50%, is very metabolically expensive, so mom can get very tired. Your nipples and areolas takes on a more darker pigment, and colostrum can discharge from the nipples, which is a yellowish precursor to breast milk, totally normal. Some women exhibit something called the linea nigra, which is a dark vertical line between the pubic symphysis and the umbilicus, or the belly button. Okay. The lining of the vagina will become thicker and less sensitive. You may notice a thin white discharge. Again, that's normal, and it's can also have some vaginal spotting, although every time you have spotting, you should definitely mention it to your healthcare professional. It does happen commonly, and most times it's okay, but you always want to err on the side of caution. The vagina also can take on a bluish color, but the vagina and the cervix can take on a bluish color as well. That's normal. And then we also have a so-called mask of pregnancy that you get that dark patchy skin around the face, okay, nose and eye area. Okay, other body changes we can see. We've already mentioned that an increase in blood volume, 40 to 50%. Okay. Blood flow will be most around skin, kidneys, and placenta. It's around the skin to help cool the body off, right? Although mom will feel more flush and more hot because there is more blood around the skin, she'll have a reddish look about her, but it's designed to help cool the body down, okay? Kidneys, more blood flow to help remove more toxins and metabolic debris, which will mean you're gonna urinate a lot more. We compound that with, as the baby grows inside the uterus, the weight pushing down on the bladder, it's going to compound the fact that you're going to have to go to the bathroom a lot more frequently. And then blood flow to the placenta, right? That placenta is the conduit between mom and baby, right? Although mother and child's blood do not mix, right? The placenta is where gas exchange and nutrient exchange takes place. You can have an increase in body temperature about 1 degree Fahrenheit. So again, you might feel hot, right? Compounded with the skin blood flow. Okay. Decrease in bone density. Now that happens because if mom's not taking enough calcium, right, the baby takes priority when it comes to calcium, right? Most other nutrients, mother takes priority over the baby, but when it comes to calcium, the baby takes priority. So if there's not enough calcium in the diet, we'll get calcium to start leaching out of bones, and we'll go to baby, especially in the 3rd trimester when such rapid growth takes place where bone and teeth are being developed. It's a high level of progesterone, which signals the body to deep breath take deeper, faster breath. Okay, again, it's going to cool you off because hot breath comes out, which means more cooling, also more gas exchange, more oxygen in the body to help mom and baby. Digestion tends to slow down. Okay, so that's something that we want to keep aware of as things like constipation. Morning sickness, although it happens at various times, not just the morning, you get nausea, vomiting, occurs at approximately 80% of women in the first trimester. So morning sickness is thought to be due to something called HCG, which is human chorionic gonadotropin, right, which is produced by the placenta. It's produced by the placenta up until about 10 weeks. After that, it tapers off dramatically, and that's usually when morning sickness stops. We're going to discuss some nutrients we can take and some things we can do to help minimize morning sickness. One of the things being B6 or zinc, chiropractic adjustments, also water. We'll get into that in a little bit. All right, we'll move on. So the three things that I want to focus on when creating the ideal pregnancy are, number one, the development of the placenta, right? The better, richer the placenta is, the better the baby is going to have a chance of developing to optimal conditions. Number two, the expansion of maternal blood volume. And then number three, the increased demand on the maternal liver function, right? So the placenta, when we talked about, it implants usually on the superior posterior wall of the uterus, right? It's there to prevent obstruction of the emergence of the fetus during labor, as well as being able to keep the umbilical cord from wrapping around the child's neck. Oftentimes, when we get a spastic uterus, we will get a baby that is breech who doesn't turn, or we will get placenta that maybe attaches in a different place, and that can cause issues. So we want to make sure that it's a little stress as possible to the uterus so that the baby does not get complicated from that stuff. Okay. Okay, we're going to start with nutrition, right? And we talk about nutrition, right? Maternal nutrition has a profound effect on the development of the fetus, on labor and delivery, and on postpartum recovery. A fetal size escalates dramatically beginning at the 5th gestational month. Okay, this increases in maternal blood volume and also has a sudden upsurge during that same month of baby. Okay, and any reduction in the amount of blood servicing the placenta impairs the ability to function and ultimately endangers baby's life. Okay. Nutrition becomes preeminent significance when the problem of maintaining such an expanding blood volume is considered. Then we mentioned liver, right? And so albumin synthesis is one of the more complicated processes of the liver, and involves selective combining of amino acids into a protein molecule that maintains appropriate amount of fluid in vascular circulation. So if albumin levels in circulation decrease, water that should be present in circulation leaks out of the tissue and causes pathological edema, leaving blood volume to be contracted below the needs of the pregnancy, called hypovolemia. Okay, now this can lead to early pregnancy. It can lead to placenta abruption, and it can be life-threatening. So we want to make sure that doesn't happen by making sure the liver is functioning properly. So inadequate nutrition can result in severe metabolic derangement and disease. Metabolic toxemia of pregnancy and placenta abruption are life-threatening, like we just said. Complications of pregnancy that result in hypovolemia and liver dysfunction created by malnutrition, specifically not enough protein intake. Okay. Maintaining a sufficient supply of nutrients available to the growing fetus is critical. In the last 8 weeks of pregnancy, the fetal brain is growing at the most rapid rate. So neurological cells are proliferating and synapses are being created. So even a mild degree of maternal undernutrition in the last few weeks of pregnancy can have adverse effects that will phase the fetal brain, will cause the fetal brain not to develop as properly as possible, as well as the central nervous system. The minimum recommended caloric intake for a normal weight woman who exercises less than 30 minutes is about 1,800 calories per day. Okay, that's going to depend on various factors like the body mass index, age, lifestyle, okay, fitness level, things like that. So the more we exercise, the more fit we are, caloric needs go up. Okay, second trimester is going to go up to 2,200 and then 2,400 by a third trimester because fetal growth is increasing at an exponential rate and just going to need more calories. There's an incremental requirement for protein, calories, vitamins, sodium, and other minerals during the last 2 trimesters of pregnancy. And trimester 3 is where diet becomes most important because that's where the brain and spinal cord develop, as well as the synapses. Interestingly enough, actually studies have proven that in utero, the baby can actually taste what mom eats. And so babies can get an affinity for certain tastes. So if you don't want a kid that's going to be cranky and not love vegetables, then you want to eat your vegetables, because the baby will get used to that and have more of affinity towards those things innately. Okay. So there's 7 categories of nutrients that we're going to discuss: carbohydrates, proteins, fats, vitamins, minerals, water, and movement. Yes, you heard that right, movement. We consider movement as a nutrient. Without proper movement, we do not get proper neurological development. So movement is an essential nutrient. Okay. We would hope that most of the nutrients come from whole foods. Okay, we have a saying that you can't improve on God, so whole foods are our best bet. We're going to use postnatal vitamins and mineral supplements as just an added insurance. Okay, but we want to make sure we have a rich, diverse diet that's getting most of our foods. Okay, our standard diets are very high in fats, sugars, processed foods, low in complex carbohydrates, as well as vitamins and minerals. So we want to make sure that we're getting whole foods and not processed foods so that we can get those nutrients in. Okay, the body needs 90 nutrients on a regular basis in order to survive and not develop a nutrient deficiency disease. Okay, needs 16 vitamins, 2 to 3 essential fatty acids, and 12 amino acids. So the amino acids is a little controversial because only 9 of them are considered essential amino acids. The last 2, taurine and tyrosine, are not considered essential. Tyrosine is semi-essential and taurine is not essential at all, but they are important in metabolic processes and brain function and in times of stress. So that's why they're on there. In addition, we need 60 minerals. Okay, there's a big laundry list of minerals. Now, we could spend all day talking about nutrition and go through each one of them, which would be, a labor of futility. So we're not going to do that because really any one of them are absent and the body's going to develop a nutritional deficiency disease, which is why we talk about having a diverse diet being your best defense and then using a supplement, postnatal vitamin, as insurance. Okay, we are going to mention a few of them. Some of the little more important ones are more well-known ones, but they are all important. Okay, the word vitamin stands for vital amine, keyword being vital. Same thing with essential fatty acid, essential being key, as well as essential amino acids being essential, right? These are things the body cannot make and must have on a regular basis in order to function properly. So let's start with protein. During pregnancy, extra protein is needed to help with fetal brain development and muscle tissue. Protein is essential for the increase in maternal blood volume, and for the formation of the amniotic fluid, especially in the mid to late months. Okay. Protein requirements increased by approximately 16 grams above the normal requirements before getting pregnant. Okay, so daily recommended intake during pregnancy is about 71 grams of protein per day. Okay, anything less than that, and then we run the risk of the hypovolemia that we talked about, not having enough blood volume, okay, or not having proper fetal development and neurologically. Our fats are our next one. So fats, we have the main thing that we want to focus on with fats are our omega-3s, right, or essential fatty acids. Okay, omega-3 fatty acids come in 3 forms. There's alpha linolenic acid, although short ALA. There's a DHA and EPA. Okay, so the one that we want to focus most on is the DHA. EPA is important too. Alpha linolenic acid gets converted into EPA, and then EPA can get converted in DHA. The process of conversion is poor, so it's probably not your best strategy to take alpha linolenic acid, because the conversion, like I said, is poor. Now, alpha linolenic acid comes from plant sources, right? And then it converts it to DHA, EPA. So flaxseed, chia seed, blackcurrant seed, hemp seed, these are all places where we get our alpha linolenic acid. Okay, so vegans will tend to favor things like that. Fortunately enough, you can get DHA from algae now, so it'll satisfy the vegans to getting their essential fatty acids in your DHA. All right, most of DHA and EPA come from fish oil, and EPA is going to support heart, immune function, and inflammation, and DHA is for brain, eyes, and central nervous system. So we want to make sure that we have plenty of DHA, somewhere around 300 milligrams, and then a total of 650 with the rest. Okay. So benefits of adequate DHA intake for pregnant moms and babies, aside from neurological development, is prevention of preterm delivery, increased head circumference and birth weight, right? They measure head circumference as far as fetal development goes. Prevention of depression during pregnancy and postpartum, and improvement of the ability of the infant for solving problems. Okay, the reason why this is because the brain is made mostly of DHA. Okay, the brain's about 60%, 50-60% in dry weight in fat, and most of that comes from DHA. So everybody that's kind of on this fat-free kick, right? Your brain is. Oh, hello. All right, just mute your mic for me, thank you. Okay, improving the ability of infants to solve problems we talked about, all right, and then support healthy immune system development. So next, we have water, right? I never go anywhere without my water bottle, right? During pregnancy, you should be drinking about 8 to 12 cups a day. It's going to mean you're going to have to go to the bathroom a lot more, but water has many benefits, right? It aids in digestion. It helps form the amniotic fluid around the fetus to help protect the baby. Also helps nutrient circulation in the body and helps waste removal. Accordingly, that shouldn't be there, sorry. It was a thought that we took out. Okay, water serves as a medium for most chemical reactions. So without water, we can kind of subvert some of our chemical reactions. And finally, water is a coolant, right? Body needs water to help cool down. Oh, no, wrong way, sorry. Okay, next is the big one that everybody is concerned about, and that's folic acid. When people look to take a prenatal, the first thing they always ask is about folic acid. So why is that? Well, because folic acid is important in DNA and RNA replication. Okay, DNA and RNA are the molecules that transfer the genetic information and translate it into tissue production. Okay, so components of normal growth of cells, it's involved in crucial synthesis of DNA, RNA, Its deficiency is associated with neural tube defects, right? So brain development, central nervous system development, hemorrhaging, placenta abruption. So the body requires about double the normal amount during pregnancy. Pregnant women should be getting about 600 micrograms of folic acid daily. Folic acid can be found in liver and organ meats. So I put liver and organ meats in parentheses because although liver is great for folic acid, it is also high in vitamin A, vitamin E, D, K, B12, and other minerals like copper and iron, all of which are needed. But your fat-soluble vitamins A, D, E, and K can become toxic at high volume, at the consumption of high volumes. All right, so just be careful with that and realize that they can become toxic. All right, so consult your doctor about that. Other natural sources of folic acid: nuts, leafy greens, especially romaine lettuce is high in folic acid. Vegetables, oysters. When it comes to oysters, you have to also be careful of the sourcing because they can be high in lead due to ocean contamination. Salmon, whole grains, lentils, asparagus, chickpeas, beans, citrus fruits, mushrooms, and fortified breakfast cereals. A little word about folic acid, right? There can be a mutation to a gene called methylene tetrahydrofolate reductase, right? Otherwise MTHFR, which sounds like a bad word that we won't say. Okay. Now, this mutated gene oftentimes people don't even know they have it because it could be asymptomatic most of the time. Most people, when they have the gene, they'll have one gene from one parent. If two parents get together and we have double gene, then we can start to see some symptoms, right? So if you inherently, so it can affect metabolism of folate and B vitamins. It's very easy to test, right? They can do a blood test to take it. So the subsequent lack of absorption of folate and B vitamins may cause such symptoms as extreme fatigue, may also increase the risk of blood clotting and miscarriage. Okay, like I said, fortunately, it's easy to detect in a blood test. Okay, your doctor most likely does as routine. Okay, and then they can give you a supplement to take that to prevent any kind of neural tube defects. Okay. The other thing when we have that mutation that we get is we get high levels of homocysteine because folate will convert homocysteine into another amino acid called methionine. Okay, and that doesn't happen with the gene. So next we have calcium. Okay, so calcium needs double during pregnancy. It cultivates the mineralization of teeth as well as the skeleton. So the fetus requires approximately 65%, 66% more calcium during the last trimester of pregnancy, where skeletal growth is most rapid. Inadequate calcium intake may result in things like sleeplessness, leg cramps, uterine pain. Calcium is a relaxer, right? It's a muscle relaxer. It's also why people say drink milk before you go to bed, to help you sleep, because it's a calm down and relaxer. Okay, mothers with sarcoidosis and hyperparathyroidism or chronic kidney disease should not supplement with calcium. It can be problematic, but only use food sources. So to prevent interference with iron absorption, calcium supplement should not be in your prenatal. It should be taken separately, and it should be taken between meals. Calcium must be accompanied by vitamin D in order to get absorbed, and also needs magnesium as well, which we'll discuss on the next slide. Beware that vitamin D through supplementation can be toxic in large dose, right? We talked about A, D, E, and K because they're all fat soluble. They get stored in fat. The B's and C's can just come out the urine if we have too much of it. Okay, so ideally about 1,000 international units. A supplement should be labeled as D3 for better absorption as opposed to D2. Calcium is a naturally occurring in dairy products. Now, I would never recommend dairy products to get your calcium. There's much better sources: green leafy vegetables, almonds, sesame seeds, tahini, fish, especially with the bones, tofu, soybeans, garbanzo beans. The problem with dairy is it can be very acidic because it's a dead product. They pasteurize it and they kill it. So not very healthy. Requirements for calcium during pregnancy is about 1,200 milligrams a day. Okay, and as I mentioned earlier, the baby's demands have first call on mother's calcium. So if mother has inadequate calcium, calcium is drawn from the bones. Okay, low levels of vitamin D puts women at higher risk for developing life-threatening preeclampsia and insulin resistance, which is a precursor to gestational diabetes. It's also linked to things like asthma, leukemia, type 1 diabetes, and children of mothers who were vitamin D deficient during pregnancy had issues with those. So next, we mentioned magnesium. So magnesium is required for strengthening bones and teeth, normal nervous system, tissue growth, muscle function, heart health, immune regulation, blood glucose levels, promoting normal blood pressure, and energy metabolism synthesis. Magnesium with B6 helps prevent, alleviate nausea during pregnancy, during morning sickness, right? Zinc can be another one that can help prevent morning sickness. When I put magnesium with B6, it's the B6 that research has shown to decrease morning sickness, but we tend to get magnesium with B6 because B6 is needed to get magnesium into the cell. So a good magnesium supplement will always have B6 with it. All right. Studies show that magnesium may play a role in preventing preeclampsia, but the evidence is not conclusive. Recommended intake is 350 milligrams. It's usually, well, there's my door. It's usually about half of the intake of calcium to magnesium. Okay, next we have sodium. Okay, so there's an incremental requirement for sodium as well as other minerals during the last 2 trimesters of pregnancy, about 3,000 milligrams a day. Now, sodium is usually in processed foods. Oops, sorry about that. So sodium is usually found in processed foods, which we do not want because it's not healthy for you, but they use it as a preservative. We can also find sodium in our garden variety table salt. Not a good source of sodium. It's stripped of any of the natural minerals that are supposed to be with it as synergists. It also has anti-caking agents, aluminum being one of them, which aluminum is a neurotoxin. Fluoride is also added to sodium a lot of times, and another neurotoxin. So I would stay away from table salt. Much better options are Celtic salt or pink Himalayan salt. Celtic salt has 92 different trace essential minerals, and pink Himalayan salt has 84 different trace minerals. Okay, so makes up about 2% of the sodium, the trace minerals, about 2%, but much better option for you to get those minerals than table salt. Okay, iron. Now, iron is essential for the formation of hemoglobin, which carries the oxygen in the blood, the fetus, and the placenta. During the last 6 weeks of gestation, the fetus stores enough iron in the liver to supplement its needs for the first 3 to 6 months postpartum. Okay. Normal pregnancy requires approximately 1,000 milligrams of iron. Of that, 350 milligrams contribute to the developing fetus, and 500 milligrams functions to prevent anemia in maternal blood, which increases in volume by at least a quart during pregnancy. Iron absorption can be enhanced by eating vitamin C-rich foods. Iron-rich foods would be things, again, like liver and organ meats, red meats, egg yolk, dried fruits, prunes, apple juice, almonds, walnuts, oysters, lentils, dried peas, beans. Many mothers experience digestive tract disturbance if they take iron in a supplement and get nausea, heartburn, diarrhea, constipation. So if we take it in smaller doses with meals, tends to reduce that. Otherwise, just get it from your foods as opposed to supplementing. It's a good idea for mom to be tested for iron twice during her pregnancy, once at the beginning and then once again at about 8 months of pregnancy. Okay, so our general guidelines as far as our diet goes is, number one, eat organic whenever possible. All right, we're going to talk about how to clean your veggies on the next slide, or in 2 slides, because if you can't always get organic, we want to make sure that we're cleaning all the pesticides off, as well as any parasites or eggs that might be on there as well. Okay, and we want to limit our refined sugars, processed foods, saturated fats, and animal proteins. So the animal proteins, a little bit of caveat there is most animal proteins that we get are grain-fed, which is high in something called arachidonic acid, which is very inflammatory. If you can find grass-fed, free-range, antibiotic-free meats, much healthier for you, and they're a lot higher in omegas 3 as opposed to omega 6, which is the arachidonic acid. Caffeine intake should be eliminated if possible, because studies have shown that even as much as 200 milligrams or more of caffeine a day makes it twice as likely to miscarriage than when we don't consume any. Caffeine can also be involved in low birth weights, as well as developmental issues. Foods containing artificial colors, flavors, additives, preservatives, artificial sweeteners, particularly aspartame, should also be strictly avoided. They're neurotoxins as well, or endocrine disruptors. Okay, nitrates and nitrites, which are preservatives that we find in hot dogs, cured meats, bologna, things like that, deli meats, should also be avoided. So when we talk about our vegetables and risk to toxicity, there's a group called the Environmental Working Group, which is a nonprofit organization that puts out a dirty dozen list, which is the 12 dirtiest foods, or the foods that contain the most amount of pesticides on them. So we would like to buy these organic if possible. Otherwise, see if you can find alternatives, but definitely want to wash these thoroughly if you're going to consume them. And they are strawberries, spinach, kale, collard greens, and mustard greens, peaches, pears, nectarines, apples, grapes, bell peppers and hot peppers, cherries, blueberries, and green beans. All right. So if you can find options, or if you can find these organically, better option, but just be careful with consuming too much of them if you're just buying them at a grocery store or something like that. The best way I found to clean pesticides is by using baking soda. You can use vinegar too. Some reports say that vinegar can leach out some nutrients that if left in a soak too long. Other problems with vinegar is it can be a little pricey. Baking soda, very inexpensive. Okay, the way to do it is you would fill a bowl or sink about 2/3 full, because you want to leave room when you add the produce. The water's going to rise. You add the baking soda to the cold water. Okay, you want to add about 3 or 4 tablespoons of water and swish it around. If you're using a bowl, it's 1 teaspoon for every 2 cups of water. So then you submerge your fruits and vegetables in the baking soda. Let it soak for 12 to 15 minutes. Just make sure you sink it every once in a while, because sometimes it'll float to the top. All right. So you also want to, if you have firm vegetables, run a little light bristled scrub brush on it just to scrub it off. If they're fragile type fruit, you can just use your hands and rub them, okay, to remove any kind of dirt, chemicals, and whatnot. Then you remove them, rinse them off, and let them dry thoroughly before you enjoy them. Okay. It's the best way to clean them. You can also get spend a little more money if you want to get a veggie wash, but clean, effective, easy way to do it is with baking soda. So we gave you the dirty dozen, right? Environmental Working Group also puts out a clean 15. These are the 15 cleanest vegetables that you can find, all right? They have the least amount of pesticides and provide the least amount of threat as far as toxicity goes. And they are avocado, sweet corn, pineapple, onions, papaya, sweet peas if they're frozen, asparagus, honeydew melon, kiwi, cabbage, mushroom, mango, sweet potato, watermelon, and carrots. A little word about the Environmental Working Group is they also have a database. It started out with just makeup, but it's grown to exponential proportions and now contains everything from cleaning products, right, to things that you find around the house. So if you go to ewg.org and you just type in Skin Deep, you can find their list, and you can type in, whatever type of product you have a concern about, and it'll pop up, because a lot of things that do not need to be listed on the ingredients menu, like endocrine disruptors, they'll show up and they'll give you a risk assessment of it. All right. This started because they discovered that babies fresh out of the womb were already toxic, and they couldn't understand why. They traced it back to absorption of the skin of the mother from wearing toxic makeup. All right. So check your makeup, right? Give your baby the best chance of a healthy, happy life, and see if your makeup is toxic. All right. So a couple other guidelines that we want to look out for. One is BPA. Okay. BPA is an endocrine disruptor. Endocrine disruptor means that it will disrupt the amount of hormones that are your body's able to use. These chemicals look and act like hormones in the body, and they confuse the endocrine system and cause disruption in normal function. You usually find them in canned foods, right? They started to replace BPA a little while back, but some foods still contain BPA. They've replaced them. I don't know if they did a better or worse job replacing, because now a lot of canned goods are replaced with a polyvinyl chlorine, a PVC, which isn't much better because that has been shown to be a carcinogen, and some acrylics as well. Same problem there. So I tend to tell people to avoid canned foods altogether if possible, right? You want to buy fresh food if you can. Okay, if you're gonna have canned foods, at least make sure that you avoid canned foods that are highly acidic. Things like tomato paste or tomato juice, or things like that. That very acidic foods will leach that lining of the can into the food. Okay, other places, receipts. So if you're going shopping, try and avoid handling any receipts. Plastic wraps, soda cans, and plastic and paper cups, the lining of those things. So use your ceramic cups if possible, all right, just to avoid that. Next thing, we have foodborne infections, right? Toxoplasmosis, E. coli, and salmonellosis, which is from salmonella. So these things we want to avoid. They're usually soil-based. So if you're doing gardening or things like that, those are where you're going to pick those up. I'm sure most people have heard the old wives' tale of pregnant women not being able to be around cats, and that comes from that toxoplasmosis. It's not the cat that's a problem, or even the cat feces that's a problem. The problem is a cat can get toxoplasmosis from outside soil. So if you have an indoor cat and you're not feeding it raw meats, you're most likely safe. It really comes from the soil and not the cat. E. coli, same thing, and the salmonella. So we have a few guidelines just to be safe. Okay, we're going to cook all our meats thoroughly where it has reached at least 160 Fahrenheit internal temperature. We're going to wash our thermometer between each test. Okay, keep raw meats separate from uncooked foods. Wash your hands, counters, utensils with hot soapy water after touching raw meat. Never put cooked hamburger or ground beef or anything on a plate that's had raw foods. Okay, drink only pasteurized milk. Again, I would not recommend drinking pasteurized milk, but I put it on there. You're a diehard milk drinker, but you should know what you're doing, and you're putting your life, not your life, but your health at risk by drinking pasteurized milk. Okay, juices and ciders. Wash your fruits and vegetables thoroughly, especially those that will not be cooked. Avoid alfalfa sprouts. Drink bottled water. Avoid swallowing lake or pool water while swimming. It can be contaminated as well. Okay, make sure the person with diarrhea washes their hands, or if you're changing diapers, wash your hands as well. And then wear gloves when gardening or when you're outside and with soil, or even with a sandbox. All right. Okay, next we want to talk about chiropractic, because I'm a chiropractor, right? How can chiropractic help improve the quality of the baby that's growing inside you and give the baby the best chance of maximum advantage of survival, not only survival, but of development? Well, so we're going to start with pregnancy and the nervous system, right? The role the nervous system plays in pregnancy is your nervous system is your master control system, right? Your nervous system is responsible for controlling and coordinating all the functions of the body. Now, when the brain's able to send a signal down through the spinal cord, and it'll control and coordinate. Problem is, especially as baby's growing, we are most likely going to develop something called a subluxation. Subluxation is when bones get pulled out of proper place, and then it causes an interference with that communication system. This is almost a certainty as we get later on in the pregnancy because of shift in center of gravity. We usually get pelvic distortions, or at least at L4, L5, lower lumbar distortions as well. Chiropractic can be very safe and gentle. We tend to modify our techniques because of that hormone relaxant that we discussed, where we're not doing a lot of hard osseous adjustments. We use something called a drop table, which is very gentle, very light. You don't need a lot of pressure. Sometimes I use a device called an activator. Again, very gentle and gets the job done. Okay, it'll improve the communication between the brain and body, as well as decrease amount of fetal stress that the baby is undergoing because of uterine constrictions. Additionally, we want to try and avoid C-section if possible. Okay, brain injuries were found in 1 out of every 664 infant deliveries from forceps. Okay, in 1 out of 860 deliveries from a vacuum extraction, and in 1 out of every 907 infants that were delivered by C-section. This is compared to 1 out of every 1,900 delivered by vaginal delivery without instrumentation, right? Why is this? Well, the fetus is not equipped with adequate protection to measure against any kind of traction. In a normal vaginal delivery, there's no traction. Okay? But with forceps delivery, upper cervical region gets pulled. Even with C-section, it's either going to get pulled from the top or from the feet, and it's going to cause issues with the upper cervical neck in a fetus, cause a baby to be colicky, cause a baby not to latch onto breast, cause problems with breastfeeding, things like that. All right. So if your baby was forceps delivery, or if your baby was vacuum delivery or C-section, you should definitely bring them in to see me or another chiropractor. Chiropractic on babies, very, very gentle. In fact, so gentle that when we adjust babies, parents sometimes think we didn't even do anything, because you're really just placing just a little pinky on a section, just giving the lightest pressure, less pressure than needed on the eyeball. And that's enough to move the joint. But without it, we create that interference and baby cannot function properly, and we get all these issues. Okay, there was a study published in the British Medical Journal that reported that compared to vaginal delivery, C-sections have twice the risk of complications and death for both infant and mother. Other problems with C-sections is when a baby's born through the vaginal canal, right? There's two important factors that take place. Number one is that the baby gets inoculated with all the bacteria that's in the vaginal canal. Right, that kind of jumpstarts baby's immune function. C-section, they don't get that, so they tend to get allergies, and their immune system tends to suffer more than vaginal birth. The second thing that happens is when the baby's coming through the vaginal canal, the contraction of the uterine contraction as the baby comes through stimulates neurological function, right? Kind of kickstarts the nervous system, right? And again, we don't get that with a C-section. Okay, World Health Organization recommends that only about 10 to 15% of C-sections are considered necessary. The average in the Philippines, where I am, is 32.86. So much higher than needed, more than double of what is considered as necessary. So benefits of chiropractic care when we're talking about delivery, right? So dilation of the cervix is dependent on normal nerve innervation. Okay? Spinal and cranial adjustments throughout pregnancy and during birth may facilitate adequate nerve impulse that's affecting the uterine function. Okay, other benefits of adding a chiropractor to your pre-birth and birth plan is, number one, it's a healthy, gentle, holistic approach towards health and wellness, right? Antibiotics are cross the placenta very easily, as well as other sulfa drugs that can disturb fetal liver. Okay, tetracycline may cause discoloration of teeth and may affect fetal bone growth. Aspirin taken daily results in higher rates of complications during pregnancy, labor, and delivery, and most notably by increasing the risk of hemorrhage, infection, or anemia. So there's no drug that's been demonstrated to be safe for all fetuses under all circumstances. All drugs cross the placenta barrier, right? So this is something that you want to consider of looking towards holistic alternative healthcare, right? Because it's drug-free. Okay. Next is enhancing nervous system function. It can help with nausea, promotes healthy digestion, reduces time of labor and delivery, reduces low back pain, sciatica, neck pain, and joint pain, which tends to be, depends on the study you're looking for, but can be up to about 96% of women who get pregnant will have some type of back pain or sciatica. Helps prevent C-sections, lowers the risk of preterm delivery, and reduces the need for pain medications during delivery, as well as faster recovery times. Right. Vertebral subluxation complex in maternal patients is basically inherent because of the weight shift that we talked about. Okay, other benefits of chiropractic care during pregnancy is study that was done, talked about women with vertebral lesions, subluxations due to change in their center of gravity, have pregnancies and labors that are abnormal compared to pregnant women without lesions. Various obstetrical complications occur with mothers suffering from lumbar lesions. An animal study was done. Offspring of subluxated mothers demonstrated stunted growth, erratic behavior, slow development, and implications in anatomical deformities. Misalignment of the sacrum in the pregnant pelvis may be a contributing factor towards musculoskeletal intrauterine constraints. So let's talk about why we can have problems with fetal development if we're having subluxations or lesions in the either the pelvis or the lumbar. And if you think about, we talked about movement being a nutrient, right? As the baby's neurological system is developing, the baby needs to be able to move, right? Because we're creating new neurological pathways. When we have a stressed or spasmed uterus, right, the baby can't move. It's under constant stress and it's not allowed to move and get the nervous system and synapses to start growing and developing properly. And that's why we get stunted growth and problems like that. Additionally, we also don't get turning of the baby, right? The baby will usually turn. So it'll be a head down position for delivery, which if we have a spastic uterus, baby can't turn, we get a breech. And this is probably the number one reason why we have C-sections other than just planned C-section, because doctors said it was okay. But stressed uterus caused the baby not to be able to change in presentation. Luckily, chiropractic it has been shown to be very effective in helping a baby turn due to relaxing the uterus, which we're going to discuss in a minute. Okay, so chiropractic can minimize intrauterine constraints, which we just talked about, promote optimal labor and delivery, improve space for growing baby. Okay, that study that I mentioned, there's the reference for it. A study found that labor time was decreased by 24 to 39% with chiropractic care. So just even in addition to all the good stuff we talked about in development of the fetus in utero, delivery times can be faster, shorter, and much more pleasant. So common pelvic subluxations during pregnancy that you might want to be aware of, okay, is the SI joint, which is that joint where the sacrum meets the pelvis. Okay, typically an individual will experience pain, numbness, and or tingling that can start in the butt, radiate down the leg, like sciatica pain. Feeling of instability, bladder and bowel control can be compromised, stiffness and reduced mobility, and the pain may worsen when walking or bending. Okay. Second common problem we have is in the symphysis pubis. Okay, that's the front part of the pelvis. Okay, usually they go hand in hand, so we always check them together. Okay, pain in the front of the pelvis, it will hurt when being touched. Can also feel pain in lower abdominals, hips, inner thighs, and groin area. Marked increased pain with activities such as walking, climbing stairs, lifting legs, or any other movement involved in the pelvis. Right? Can you start to see how when we get this pelvis in shifting, it can cause stress to the baby? And then we have the ligaments that attach to the pelvis. So number one being the round ligament. The round ligament in that picture on the left right here, you can see attaches to the uterus and attaches to the front part of the pelvis here. So if we get subluxations or misalignments here, we get uteral problems. And mother can feel pain right in this area and this area, and baby can be restricted in movement. Okay, very easy to fix. We use a technique that is called the Webster technique. Webster technique was developed to address this very problem by a chiropractor named Larry Webster. Okay, sacral rotations causes an anterior torquing mechanism of the uterine ligaments and musculature, decreasing the space and altering the environment for the fetus. Okay, the technique's intended to indirectly reduce in utero constraint by reducing pelvic misalignments and tension. There's been a number of key studies that have shown the procedure to be effective in turning breech presentations and alleviating difficulties during the birth process. And there's references to two of them there. Intrauterine constraints during pregnancy may cause irregular spinal development in the fetus as well. Okay, compromised fetal positioning may affect spine and nerve development in the fetus with long-term risks of malfunction. Abnormal uterine constraints may be a cause in deformities in the upper cervical, including the foramen magnum, which is the skull, the base of the skull. Okay, going to move on to exercise. Okay, this is the last topic we're going to cover because I'm already we're about an hour in. So this last topic is exercise. So I'm going to start exercise with the reason why it used to be that it was thought women shouldn't exercise during pregnancy, and that all stems from a study that was done a long time ago, and it found that on-the-job physical stress increases incidence in premature labor as a result of both blood pressure and the rate of blood flow to the womb are reduced during protracted periods, all right? Because what happens is the reduced blood flow coupled with falling blood sugar, limited oxygen availability, and decreased nutrient supply to the baby, which slows the growth of the baby and increases the irritability of the uterine muscles and the risk of premature labor. Okay, what happens is usually if a woman stands for long periods of time, right, we get pooling of the blood in the feet due to relaxed veins. We get swelling in the lower quadrants, the ankles, right, decrease in blood pressure, back pressure will increase, extended veins, a bunch of these things. And the research shows that prolonged job stress increases the number of infants who weighed less than they should from the time they were born. So this was thought to be that just too much stress on the body, but it turned out it's this prolonged stress along with lack of nutrients, along with lack of adequate water supply that was causing the problem. But later studies have shown that exercise does not do this. In fact, exercise is not only safe and effective when done with proper protocols, but it's also very beneficial to developmental fetus. So the work-related stress that was found was quiet standing for 4 or more hours in a shift, walking for protracted periods, long work shifts, frequent heavy lifting, infrequent breaks, lack of water intake, and if the mom doesn't eat frequently, her blood sugar will fall, right? So dehydration is compounded by being on our feet for a long period of time, and blood collects in pools of our feet, you know, but this stuff doesn't happen with exercise, okay? So with exercise, what have the research found? Well, it's found that we get shorter labor times and faster, easier delivery. We get a psychological lift, higher self-esteem in mom, decrease in back pain, headaches, and fatigue, less shortness of breath, right, because of that progesterone that we talked about earlier, increased rate of growth of placenta volume, grows faster and functions better. Increase in fetal heart rate, reduce postpartum depression, healthier babies, decrease fetal fat without decreasing overall growth, and reduce insulin sensitivity. Okay, so in this next chart, right, shows you that what happens is that moms who exercise tend to deliver babies earlier on in the normal 37 to 42 week range. You can see the black line is moms who exercise and the gray line is control. So much higher delivery rates earlier on in that 37, and then they jump way, way higher in the 40, 41, 42 for the control group. So if you like being pregnant, then don't exercise, right? If you want to get that baby out of me, right? And it's a good idea to exercise. So there's a little caveat here, right? The studies that are done are showing that typically moms who have been working out prior to getting pregnant, they don't have to work out as hard and as long as if we start an exercise program either when we get pregnant or a little bit into our pregnancy. We have to work probably about double the amount of work being done if we start the exercise program after we're pregnant. The other thing that we found with regular exercise is that moms who exercise on a regular basis will deliver healthier babies with less body fat. Right? The birth weight is within normal limits, but they check by measuring circumference of the head, and that is normal, but a lot less body fat, which means healthier babies. So changes in fitness outcomes throughout pregnancy. All right, what's going to happen? Right? Well, during the first trimester, okay, physical fitness will decrease. Why does that happen? That happens because I think it's in the next slide. When I go off script and I jump ahead and I just start talking, that's when I get in trouble because then that comes up in the next slide. So I'm going to wait. All right, let's stick with the slide. The second trimester, physical fitness will increase, although rarely to pre-pregnancy levels. As body weight increases in the third trimester, physical fitness will again decrease, and the amount of work of a pregnant exerciser should be decreased as well. Sometimes as simple as a good brisk walk about 3 times a week, 3 times a week for a half an hour enhances the body's ability to handle toxins and improve calcium metabolism. Most women can resume exercise program 6 to 8 weeks postpartum. Okay, you just want to make sure that you're not bleeding anymore, and then you're most likely to start. But always consult your physician. All right, here's what we were talking about. Okay, so the first trimester, right? What happens? Why does our exercise levels decrease? Well, that relaxant that's getting mom ready for expanding body parts, it tends to relax blood vessels, but the blood volume isn't there yet. So heart rate tends to increase because we have the same blood volume, but we have dilated vessels, which means the heart has to work much harder. So typically we'll get a higher resting heart rate. We won't be able to get our heart rate as high for the same amount of exercise that we're doing, right? Sometimes it is one of the key factors that mom realizes she's pregnant, is because the heart rate is elevated, even though we're not doing the same amount of work that we were doing prior, like on a treadmill. Exercise heart rate is as it goes increase, like we just said. So typically when we are in the first trimester, normally you would use your heart rate to determine where your target heart zone is when we're exercising. Can't really do that during first trimester because of all the things we just mentioned. So we're going to use a rating scale. Now, exercise physiologists tend to use something called a Borg rating scale. I've never been a fan of the Borg rating scale. On the next slide, I'll show you exactly why, and we'll give you a better option. Okay, second trimester, blood volume rapidly expands. Okay, so the amount of blood pumped in the heart raises. Right? Exercise heart rate will gradually fall by mid-pregnancy. Relationship between heart rate and exercise intensity is usually similar to before. So fitness levels will rapidly rise in the second trimester because now there's more blood to handle the workload. Okay, resting cardiac output is going up, so resting heart rate does not come down. Okay, and then the third trimester, that we get a decrease again due to a rapid growth of the baby, which is a heavy metabolic demand. So we'll drop that fitness levels again. All right, so oops. On the left is the Borg scale. Hopefully you can read that. Borg scale goes from 6 to I believe 20, right? It was made to kind of mimic heart rate, right? 6 being 60 beats per minute, which is a resting heart rate, and right, so 16 would be 160 beats a minute. But in my experience, it's not really a good way to say, hey, you know, how intense are you on a scale of 6 to 20, right? It doesn't really hold much weight. So I prefer using a scale of 1 to 10, right? Where are you on a scale of 1 to 10? 1 being, you know, sitting, doing nothing, and 10 being very, very intense. You probably want to be somewhere between a 4 to 6. Okay. So ACOG, which is the American College of Obstetrics and Gynecologists, their guidelines for exercise during pregnancy it's not too much different than non-pregnancy, right? In non-complicated pregnancies, women should be getting an accumulation of a minimum of 30 minutes of moderate exercise a day for most, if not all, days of the week. Most activities are safe with a few exceptions. Really, it just comes down to common sense. You want to avoid things that can cause trauma to your abdomen, things like contact sports, downhill skiing, stuff like that. Scuba diving should also be avoided because the baby's immature circulatory system cannot handle decompression. So you want to avoid that as well. Shallow dives, if you must, is not that big of a risk, but we want to avoid deeper dives. Exercise in a supine position, as well as jerking, bouncing movements and deep flexion extension should be avoided after 4 months. The reason why we don't want pregnant moms to be on their backs for long periods of time is because as the baby grows, the baby can push weight on the venous return of blood and can kind of stunt that circulatory system, and then mom can get lightheaded, dizziness. If that does happen, where you're lying on your back and start noticing that you're getting a little lightheaded, just roll over on your side and it'll pass relatively quickly. Don't try and get up, turn on your side and wait for your circulation to continue. Additionally, women who are pregnant should also be cautious when getting up from lying down position because of something called orthostatic hypotension. Right? It takes a little longer for blood to get to the upper regions of the body when gravity changes because of that relaxant. So just take your time and be cautious as we change positions. So guidelines, exercise should be stopped immediately, okay, if any of the following: vaginal bleeding, dyspnea prior to exertion, right, which is difficulty breathing, dizziness, headaches, chest pains, muscle weakness, calf pains or swelling, could be thrombophlebitis, preterm labor, decreased fetal movement, and amniotic fluid leakage. Okay, any of those happens, it is considered an emergency, and you should seek medical care immediately. Guidelines for contraindications to aerobic exercise during pregnancy. They're relative guidelines; they're not absolute. Those would be severe anemia, okay, unevaluated cardiac arrhythmias, chronic bronchitis, poorly controlled diabetes, extreme morbid obesity, extremely underweight, history of extreme sedentary lifestyle, intrauterine growth restrictions in current pregnancy, poorly controlled hypertension, orthopedic limitations, poorly controlled seizures, poorly controlled hyperthyroidism, and a heavy smoker. And exercise, I just did that one, didn't I? Did I miss one? Sorry. Oh, we got a double slide. Sorry about that. So general guidelines, right? Typically, you don't want your heart rate going above 140 beats per minute as for the general pregnant population. We don't want to take our joints to end range because of the relaxant issue. We don't want to create hypermobile joints. Jumping, jarring motions, rapid change in directions, or rocky terrain, unstable ground should be avoided, again, because connective tissue laxity, not because there's a danger to the fetus if we're doing any like impact. It's more to do with the joint connective tissue. Okay. Vigorous exercise should not be performed in hot, humid weather during periods of febrile illness, being fever. Okay. The reason why is because mom's ability to gauge overheating tends to be a little compromised due to all the things we talked about before: increased blood volume, right? Increased blood to the skin. Okay. Extra temperature because of the progesterone will increase a basal metabolic temperature. Okay. Care should be taken to gradually raise from the floor. We talked about that already. Liquid should be taken liberally before, during, and after exercise to prevent dehydration. During second and third trimester, avoid exercises that involve lying flat on the back. They decrease blood flow. And resistance training should also be minimized. The inevitable upward and outward shift of the woman's center of gravity as uterus grows and protrudes by maintaining back strength, good posture, and abdominal muscle tone. So if you're just starting an exercise program as a way to improve your health during your pregnancy, you start slowly and be careful. Always consult your medical professional before you start. Listen to your body. Your body will naturally give you signals that it's time to either reduce or even stop an exercise program. Things like lightheadedness, nausea, overheating, shortness of breath. Never exercise to the point of exhaustion or breathlessness is a sign that there's not enough oxygen getting to you or your baby. Wear comfortable exercise footwear that give strong ankle and arch support. Weight training should emphasize improving tone, especially upper body, abdominal area, and core. Avoid lifting above your head due to the excess weight on the low back. And include relaxation and stretches. We don't want to stretch to end range, but we do want to get full range of motion. Okay, so that pretty much handles our guidelines as far as exercise. Again, I had to cut a lot out because otherwise I would be taking all day to do this. So if you survive this lecture and you're still with me, I can't really see who's on it because I don't have my thing here, but if you watch this and you survive and you're still talking and you're still listening with me, and you want an exercise prescription, just drop me an email or a message on Facebook, and I will send you out an exercise prescription for your pregnancy. All right. Additionally, if you found this of value, like and share it. And if you want to come back for our next lecture, which will be in the end of July, we're going to be doing a lecture on how to unlock the potential of your child. Right. It's a good follow-up to being pregnant. It's going to be a neurologically based lecture. Okay. Because every child deserves a chance at a great life, and you can drastically change the trajectory of a child's life by just implementing some very simple, easy, neurologically based, fun games and exercises, provided with a little bit of nutrition to unlock their potential in helping them fulfill their future. Okay, that is about it. Lastly, I want to end with this limited offer. If you are pregnant, be pregnant. Right, you don't have to. We'll take your word for it. You don't have to bring in a pregnancy test. But anybody that's pregnant, we are going to knock 1,000 pesos off of your initial exam in our clinic at Form and Function Corrective Chiropractic. We are located right next to Ayala Mall in Cebu City. So if you're pregnant and you want to make natural holistic healthcare part of your birth process, okay, to ensure a happy, healthy pregnancy and give your child the best chance of a head start, give us a call, and we'll knock 1,000 pesos off of your initial exam and your initial adjustment. All right. Thanks for joining me. Hope you found this useful, and hopefully I will see you at the next lecture. Okay, take care.